Why don't surgeons tell you about scar care? I've had multiple surgeries for endometriosis, for torn tendons, now for breast cancer, and I'll tell you what I was told from plastic surgeons. 2 weeks ago, I had a lumpectomy and I have scar across my top of my areola and this one under my arm. They use surgical glue, so the one that's on top of my areola still has a bunch of glue on it, so I'm not going to do anything with it, but here I can put on just Palmer's shea butter. This is what my breast surgeon for the implants had told me to do starting at 2 weeks. You can see how the scar turned out here. It's very, very light and flat. What this does is helps to soften the scar so it will start flattening out. So you just put a little bit on a few times a day. For my face, I was recommended to use Strataderm. Like these little incisions that were in my hairline and then my eyelids. This is a silicone scar gel that's supposed to help flatten out scars as well. This I started at 2 weeks on my face. Felt like this worked great in my face, but I didn't find that this worked on my knee. This seems to work better on fresh scars and not older scars, although it did decrease some of my other scars as well. I had my implant for the mammary scars under my breast. The surgeon had recommended Biodermis, which is a silicone scar tape. It's through the 6 months process that you slowly flatten out the scar. Biodermis is really nice because it has the fabric on the other side of it and you can reuse it, wear it for 12 hours a day. I didn't find it to be any more effective than these, which my sister got from Amazon for like $15. I wish I could show you my sister's breast because she had a bilateral mastectomy with a tug flap. There was a scar across the front, but she sent me a picture recently as we were comparing scars and it is completely flat and completely healed. You can't see anything, and this is what she used. About 4 to 6 weeks after your surgery is when I'll start using these. It's just as soft, a soft silicone piece of tape, and it's soft and it bends around your body. Ideal for like a flat, straight surface. So if you're someone who did a tug or deep flap, sister found it very difficult to have them on her legs because the legs were not straight, they're kind of curved and you're moving around. So you might want to experiment with some of these. The Biodermis ones, I felt like would be better for a rounded area or area that's a little harder to use. These ones, my sister said, are more like steri strips and you can leave them on during showers. You're really only supposed to be wearing them for 12 hours a day because you want to allow your skin to heal as well. That should help decrease coloration and the thickness of the scar. Now that I'm getting closer to being able to use more scar products, I'd like to know what are other products that you like to use.